Hello, everyone. Today on That Ortho podcast, I'm here with Dr. Richard Kahmann.
Hi, Dr. Kahmann here.
He is a spine surgeon who did his undergraduate years at UCLA, his residency at UCLA, his medical school at UCLA, his internship at UC San Diego, and then 2 years later he did a spine fellowship in Minnesota. He is one of the best spine surgeons in Santa Barbara. And he's here today to talk about his whole career and his expertise and everything about that sort. So let's get to it. So, Dr. Kahmann, how did you decide on medical school? Did you always want to be a doctor, or did the pieces just fall into place?
I went to UCLA undergraduate, and when I started school there, I didn't really have a clear idea of what my career path was. I always loved medicine. I always loved reading books on medicine when I was a child. And I kind of had an inkling I would go into some type of medical field, but I had a horrible fear of blood. And at the sight of blood, I would faint. And I got that phobia from my father. And toyed with the idea of going to law school, toyed with the idea of being a dentist, and then ultimately decided what the heck I should apply for medical school and was accepted at UCLA.
So you actually had a fear of blood. How did you overcome that phobia? Obviously now you deal with blood constantly.
Right. I mean, it was strange when I look back on it, but it really wasn't a phobia based in a real fear. I mean, it was my father. Anytime he would have a sharp knife near somebody's finger if they were cutting some type of food. He would faint, and I somehow developed that same phobia and that same fear. And then basically over time, through my anatomy lab at UCLA, once I got into the medical school, going and observing surgery, I realized it wasn't a phobia found in fact, and so I was able to get over it on my own.
That is amazing. So anyways, switching topics here a little bit. Were there any important figures or role models that helped you through the tough times of the medical journey? Obviously, medical school is notoriously known as one of the hardest graduate programs in the country, rightfully so. You want your best doctor to be operating on you. But during the tough times, who did you go to for help?
During my medical school, many of the professors at UCLA were unbelievably supportive and would always be there for you. Was there anybody in particular in medical school? Yeah, I think in the Department of Orthopedics and also in the Department of Plastic Surgery, there's two people that were very important, but primarily Dr. Dawson, who was a professor at UCLA and who unfortunately passed away several years ago, was instrumental in my going into orthopedics. And then when I was in orthopedics, he was very instrumental in me becoming a spine surgeon, as he was a spine surgeon himself. And then he was the one that drew me to this or directed me towards this program in Minnesota at the Twin Cities Spine Center where he had trained. And then he pushed me in that direction or nudged me in that direction. And that's where I trained. And it really helped me make me into the person, the professional I am today.
Yeah, so kind of going into your career, orthopedics consists of a wide variety of orthoskeletal bodily components, ranging from the foot to the shoulder. How did you decide that you were going to be a spine surgeon?
Well, first of all, how did I decide to be an orthopedist? And part of it, I said that Dr. Dawson had a tremendous influence. But more importantly, as I went into medicine's kind of a nerdy profession, and a lot of the professions I didn't really have a liking or a affinity for the people that practiced in them because it just wasn't my personality and my lifestyle. And I found that orthopedists were very happy people, were around healthy people who happened to get injuries, and that really drew me to that particular field because in general I'm a happy person and I like to deal with pleasant situations. Now, in spine surgery, back in 1987, when I was a chief resident at UCLA, spine surgery was really in its infancy. That was just around the time when MRI scan, which everybody hears of now, and if they come in with an injury, everybody wants to get an MRI. Well, that was just starting at that point in time. I did some of the initial studies on correlating what came out of an MRI scan with what we actually see in human anatomy. Spine surgery was very much in its infancy. A lot of the tools that we use today weren't even developed. A lot of the computers didn't even really exist for use in orthopedics, and they didn't exist in terms of how we use them today in the operating room. So it was really a field that was in its infancy, and the spine's very complex. Not as much was known about it, and it drew into that field because of that, and also the fact that I could be intricately involved in developing the tools going forward that would be used in orthopedic spine surgery. So that's what drew me to that field.
So you've been practicing orthopedic medicine for over 35 years. You've had a highly successful career thus far. How do you think the landscape of orthopedic medicine, and you've mentioned sort of the technological side, and especially as we continue forward in technology, we keep advancing forward, how do you think the field will continue to change in the future for future orthopedic surgeons?
I think that's a multifaceted question. Number one is, do I think that the technology and the treatment of orthopedics will continue to evolve and improve with time? Absolutely. I mean, we're, with computers, artificial intelligence, new materials, that will have a huge influence on going forward in orthopedics in terms of how we treat patients, making sure that we treat patients and doing the least amount of damage to their body when we treat them, microsurgical procedures, computer navigation, etc. That's all that field is exploding. So that will continue to evolve. But secondly, it's the delivery of medicine. And I was fortunate in my mind to be able to develop my own practice, go into private practice, run my practice as a business. And I think today it's evolving towards more of a model where you work for a larger corporation, you work for a hospital. But I still think there's that opportunity to maintain your independence in a private practice. So I think for those coming out today and going into orthopedics, they're going to have the extra challenge of trying to make themselves, number one, be well trained, but also marketable and be very smart in the business of medicine, which is very different than it was when I came out 30 years ago. So I think there's lots of opportunity in medicine, lots of opportunity in orthopedics. You just got to come out and be able to work hard and try to understand the landscape, because there's a lot of big players in there today that there weren't 30 years ago. So I think the future is bright, but it's a changed environment.
You brought up artificial intelligence. You brought up some of the new machinery that is being developed year after year. I actually had an interesting discussion with my housemates about this recently. Some of them are engineers, some of them are physicists and stuff, and they believe that the future of medicine lies in machines. And of course, I want to be a doctor, so I am very much in tune with the patient side of medicine, which is something that you brought up, and the delivery of medicine. And so in my opinion, it is hard for me to believe that there are going to be machines that somehow replace surgeons in the future. What do you think about that?
I think there's that debate going on today. There is a politician that's involved in healthcare who feels that all physicians should be the equivalent of a physician's assistant or a nurse practitioner, not to demean those specialties at all, but rather they feel that physicians think too much and are too smart, and just let the machines and the computers run your practice, give you your best treatment plans, and then have your semi-skilled workers carry those plans out. I'm of the opinion that you really need a highly skilled surgeon and or physician that understands the whole medical landscape, understands the patient, is able to communicate with patients, and use that expertise in combination with artificial intelligence or computers, because really I think the computer and the artificial intelligence can take a tremendous amount of data and crunch it and present you with uh, a lot of different types of scenarios in medicine. But I still think it's going to be the human that has to look at that data and say, does this data and do these suggestions really apply to my patient and my particular patient, to be able to make sure that you do the best for your patient. So I still think, even with all this computer power and all this artificial intelligence, that the physician still is going to be an intricate part of healthcare decision and healthcare delivery to make it a sane process.
Yeah, it's a very interesting point, indeed. So, on your patient side of things in your practice, how do you like to communicate with patients personally? What is your view on practicing medicine and how you should deliver it to your patients?
Well, I mean, I think I have an opinion on one type of healthcare delivery. My opinion is I spend more time one-on-one with a patient than I think the average physician. And that allows me to get to know that person, understand their personality, understand their problem. And those things that are all really important in terms of trying to make the best decision for and make a treatment plan for that particular patient. Other models of healthcare and where healthcare is headed today are a lot of healthcare paraprofessionals like physician's assistants and nurse practitioners that can do a lot of the interfacing with patients. But in that situation, the physician's interaction with that patient is vastly reduced. And I think that has a significant negative impact on the delivery of care and the best care to that particular patient. Now, other people argue that it's too expensive. My model is too expensive, too time consuming. So I think there's probably a happy medium between the two. I agree. It's more expensive what I do, but I think a lot of patients demand that and want that, and will seek out those that deliver that type of care. So I think there's room for both, but I prefer the model where it's more physician-centric, and it's patient-centric, but with the physician at the helm of the model, and delivers most of the care.
Yeah, I totally agree with you. I've had a firsthand glimpse of that, and I think spending as much time as needed with your patient, although it could be expensive, I think really benefits them in the long run. So switching gears a little bit and going into more of a reflective state of mind, what kinds of advice would you impart on the future generations of doctors? Any helpful tips in general?
I mean, if you're looking at my tips and advice on somebody that is looking at pursuing a career in medicine or a career in surgery, it's number one is make sure that you really like what you're getting into. And what I mean by that is, medicine's exciting. It's a tremendous opportunity to dive into learning about things that will blow your mind. I mean, that are amazing. But it's going to take a tremendous time commitment. And, you've got to be able to say, okay, if I'm going to go on to medicine, I got to be able to carve out 8 to 10 years of my life where you're dedicating 90% of your free time to that particular career. If you can't do that, don't go into medicine. It's not worth it. But just really make sure that that's truly what you want to do. And if you decide that's what you want to do, it is the most fun and it's the most fun endeavor, and you get positive feedback along the way. If you're not really committed to it, it's the most torturous, unforgiving, horrible experience. I had a number of friends of mine that went into medicine thinking that's what they wanted to do, didn't go in, didn't do it for the right reason, and ended up leaving medicine and going into some other career. So just make sure you're dedicated to it. Once you're dedicated to it, the rest is easy.
Sweet. So, kind of in the similar light, what would you tell the 21-year-old version of yourself if you could go back in time? I'm 21 right now. I can hardly imagine, being able to reflect on my time here as a 21-year-old. But I'm sure as you've, aged, what are some of the lessons that you would teach 21-year-old Dr. Kahmann?
21-year-old thinking about going into medicine, what I just touched on before, making sure that that's really what you want to do and then commit yourself fully to it. I was in that frame of mind, so I can't really tell myself to do anything different about that. The one thing that I would develop or emphasize is the fact that you got to understand the business of medicine and you've got to understand the business of life. And I think if you go into medicine, you got to make sure that if your medical school doesn't do it, that you do it on your own, where you really learn about personal finance, business finance of medicine. Because even though it's not about money, medicine is not about money because you want to treat patients. It is about money in terms of being able to run a business, being able to be successful financially, and to be able to be successful in life. And that means also if you get married and you have children, you want to have all that financial part of life in order so that it makes life much smoother and easier. Because you want to spend your time about medicine, you want to learn about medicine, you want to struggle in other parts of your life. So that would be advice that I would give somebody.
Yeah, along those lines. So you've had a long day of surgery or clinic. What do you like to do outside of medicine? What are your favorite hobbies or experiences or, foods to eat? What is Dr. Kahmann like doing outside of the office?
I mean, if you go back over my career for 30 years, what I like to do either on a daily basis or I like to do on a multiple times a year is, number one, you got to exercise. You got to keep your mind healthy. You got to keep your body healthy. You've got to exercise 35, 40 minutes a day, every day, no matter what. That comes first because you got to take care of yourself. You got to take care of your family. Number two is you got to do interesting things outside of medicine. I mean, I like to ski. I like to rock climb. I like to mountain climb. You got to have a lot of interesting hobbies and things that keep you interested in doing other things besides just medicine. You got to keep your mind well-rounded continuously. I think if you keep yourself healthy physically and you keep yourself healthy mentally doing these things, it's going to be a very rewarding life because you're going to get stimulated beyond belief in medicine in terms of, things that you do, things that you have to prepare for, taking care of patients, stressful situations. All those things are a fun part of medicine, but if you keep yourself mentally fit and physically fit, you can deal with those challenges in medicine so much easier. And I mean that, I learned that early on, but thank God I learned that early on, and that's something that I really think that people need to emphasize that are physicians.
Well, that was my last question for you today, Dr. Kahmann. I just want to personally thank you very much for spending the time to record this with me. And I hope that you all, the audience, can get a lot of valuable information from Dr. Kahmann. And like I said, he's a great person. He's a great guy to work with. And I really appreciate you.
No problem.